So let's talk a little bit about the hormones, because I think that is very important for us to be on the same page of what the hormones are all about, which ones are going to be the most important to replenish, and how to do it, which is going to be the focus of this video right here. Okay, so let's say that you're low on testosterone and estrogen, and you're wondering, so how can I put those back in my body? Well, first of all, you want to make sure that you're using bioidentical or hormones that are the same molecules as what you've always had in your body. Okay, you don't want to be taking synthetic stuff that can cause a lot of side effects that nobody wants. Okay, so once you know that, you decide, okay, so what route of administration? I mean, I can do all kinds of different ways. Okay, so I'm gonna write here some of those ways, so then we can go over those. Okay, so one of the main ways that that hormones are put in the body, one of them is through topical. Okay, and those are creams and gels and things like that. Okay, so the topicals are done typically once a day. Okay, and when we look at a graph of how that is absorbed, because I like sometimes to put things in a visual form, here you have the hormones, the levels. Let's say this is testosterone. Okay, and in women, I mean, there's debate about what is the best number in which we should be, but we know, after thousands of patients that we've seen and a lot of the lectures that we go and the training that we get, that typically above 60 of testosterone, women definitely notice that they feel a little bit better. And between 60 and 120 is going to be a general goal. Some people shoot between 80 and 120 as a general goal, but in reality, I mean, it's going to be depending on the patient and making sure that it's working for them rather than just following some numbers. Okay, now let's say that you're right down here at 14, which a lot of women are, and you put a cream. What is that going to do? It's going to do this. Okay, sometimes the cream actually can go higher, but it's going to go up and it's going to go down, and the next day is going to be at a lower level, and that's something that we know, because when we check and you didn't put the cream on the next day, we can see how the level definitely is going to be lower. Now, what we want to know is, okay, so I put the cream on, it stays that amount of time. Where do I get the effect? It's going to be typically here. Once you start dropping from there, then you're not going to get the effect that much, and at some point you're going to be there during the day. Okay, now the next one that we have is going to be the sublingual, and the sublingual is going to be one of those that you put under your tongue. You do it twice a day, and it dissolves pretty quickly and absorbs to your body pretty quickly. There's different kinds. There are the rapid dissolving tablets, there's troches. Both, they do the same, they absorb through the mucosa, but you want to make sure that you don't swallow much of that, as much as you can, because you don't want to take testosterone and estrogen through your mouth. Okay, and it's just processed by the liver differently, and you don't want to do that much. Okay, so sublingual twice a day. When you put it in, it's going to do that. So there's spikes and troughs, and you're going to be at some point in the good zone, but there's going to be pretty much just more fluctuation on the levels, and at some point you're going to be under, and at some point you're going to be at the good zone. Okay, now the next one that we have is the pellet, and the pellet is done in women once every 4 to 5 months. Okay, so the pellet, different than the other ones, what it would do is you put the pellet in and it'll do that, and you won't get down here until the pellet runs out, and that might be after 4 to 5 months. Okay, so it gives you the most advanced form of hormone replacement therapy, because it gives you therapeutic levels consistently for a long time, and we avoid the fluctuation. We avoid did I forget about that, or the refill, or all that kinds of stuff. It just helps us know that you're at a good level. So how do we know that you got to that level? We check here around 6 to 8 weeks or so. We'll check out, and if you're not here, we'll give you a booster for free. because you're guaranteed that you're going to get to the right place. Now, testosterone and estrogen are the ones that you can do in this manner, okay? If you need progesterone, progesterone is differently, okay? Progesterone is a hormone that, and we can talk about it in a minute, okay? So with this, what are the downsides of some of these? Well, topical creams, you know, you need to wash your hands very well and things like that. If you have kids, you want to make sure that they don't, you know, they're not exposed to those, and you know, just avoid contact with things that later on are going to be touched by somebody else. Especially, you know, if it's a guy, not that much of a problem, but if it's a kid, it might be. Sublinguals, you don't want to swallow it. That's one of the main things, and it absorbs and you know, gives you more fluctuation. The pellet is one of those things that gives you sustained release, and if we're talking about downsides, maybe is that the side effects of testosterone, if you have it at a higher level and it's giving you side effects, then it's in you, so you need to really let it run its course a little bit, you know. So that would be the one thing with this. Now, all of them are options, so I mean, in reality, whatever you choose is gonna be okay. In terms of the pricing, the topical creams tend to be, I mean, it depends on the pharmacy, but it's gonna be anywhere from, I mean, 60 to 80, sometimes a little less, sometimes a little more. The sublinguals is like 45 to 60s, and it really depends on the pharmacy that you go. And this, in our area, some of the experience that patients tell us that, you know, how things are running. And then the pellet is something that it's like buying medicine in bulk. It's 4 or 5 months of the medication that are there that you're buying at once. So that is $325. And so when you break it down, it might be kind of similar. The difference from this is that you don't have to remember, and you get to the therapeutic level and then you just forget about it, and it seems to be much more potent in some of the benefits that you get. All of them are options. You need to choose which one is the one for you, and if it's something that you want to do. Now, the other thing is progesterone, and it's important to talk a little bit about progesterone, because progesterone, bioidentical progesterone, is something that is going to be very important to take if you're on any kind of estrogen. Now, if you have a hysterectomy, it might not be so much of an issue, but still, you want to have progesterone balancing out. Hormones are like a harmony. You want to have progesterone balancing that estrogen, okay? And women that had low progesterone for a long time, sometimes they tend to have heavier bleeding, you know, heavier periods, more breast tenderness, irritability, depression, mood changes, pains. I mean, all that kinds of stuff is more notable when you have low progesterone and high estrogen. Also weight gain. So it's very important to have progesterone on board. We'll tell you how to do it. If it's, you know, if you need to be on progesterone, 100 milligrams is the starting dose in which it's started. It's made by a regular pharmacy, even though it's a compounded formula. And the only thing that is had peanut oil, so just make sure that if you're allergic to peanuts, then don't do the regular one. We might have to compound it for you. If we want a lower dose, we can compound it. Let's say that we want a 50 milligrams, we can compound it for you, and then that would be something that we could do. We can even do an extended release, and we'll talk about those things as we need. It depends on the person, but I mean, this is going to be important to have this on board. It's going to be very helpful for different things, you know, mainly, you know, sleep quality, anxiety management, sometimes mood, can be good for the bones, for the skin. I mean, just name it. There's a lot of benefits from it. And in terms of the testosterone, the main benefits are going to be energy, are going to be, you know, brain fog, libido, muscle mass. Okay. When we talk about the estrogen, the main benefits are going to be, you know, decreasing hot flashes, helping with urinary problems. That it could be things like dryness, well, you know, even vaginal dryness too, dryness or incontinence, or even infections, UTIs, okay, can be related for having low estrogen. And, you know, the bones and a lot of other benefits too. So we just need to look at the specifics, but at least you have an idea of how those are going to be replaced. You don't want to be doing testosterone or estrogen by mouth. If we do the progesterone by mouth, that one works better by mouth, typically for the things that we were talking about, okay? So I hope that this was helpful, and you have any questions, just let us know. Thank you.